Natural methods of contraception.
The cervical mucus method. The cervical mucus method is a type of natural family planning, also called the Billings ovulation method. The cervical mucus method is based on careful observation of mucus pattern during your menstrual cycle. Cervical mucus method is a way to identify fertile times to help you gauge the best days to have or avoid unprotected sex. Tracking your cervical mucus method for either fertility or contraception is inexpensive and doesn't have any side effects. Before ovulation, cervical secretions change, creating an environment that helps sperm travel through the cervix, uterus, and fallopian tubes to the egg. By recognizing changes in your cervical mucus, you can try to pinpoint when you're likely to ovulate and when you're most likely to conceive. If you're hoping to get pregnant, you can use the cervical mucus method to determine the best days to have sex. If you want to avoid pregnancy, the cervical mucus method can help you figure out which days to avoid unprotected sex. Using the cervical mucus method for birth control requires motivation and diligence. If you don't want to conceive, you and your partner must avoid having sex or use a barrier method of contraception during your fertile days each month. These are the example of cervical mucus stages. The first one is the dry phase. Dry phase is not fertile. Days 1 to 3 after period. Dry or mostly dry. Second one is the sticky phase. Sticky phase is also not fertile. Days 4 to 6, it is white or cloudy form sticky globs. The third is creamy phase. This creamy phase is semi-fertile. Days 7 to 9, creamy or cloudy, thick. Clear phase, fertility magic. Days 10 to 14, stretchy and slippery. How do I check my cervical mucus? This chart is reminding you how you check your cervical mucus. The 2-day method. The 2-day method is based on the presence or absence of cervical secretions to identify fertile days. To use this method, women are taught to note every day whether they have secretions. If they had secretions on the current day or the previous day, they consider themselves fertile. In 2-day method, you check your cervical mucus at least twice a day and then ask yourself these 2 questions. Did I note any secretions today? If the answer is yes, then you can get pregnant today. And if the answer is no, ask another question in yourself. Did I note any secretion yesterday? If the answer is yes, you can get pregnant today. And if the answer is no, pregnancy is not likely today. How to use the 2-day method. First is identify secretions during the day. And the second one is when you are going to bed, think whether you had any that day. And the third is determine whether you are on a fertile day and decide whether you can have sex or not.
Symptothermal method refers to a natural form of birth control. Siya yung nag-predict sa babae kung kailan ma-fertile ang ovulation. According to Planned Parenthood, symptothermal method has a combination of 3 fertility awareness techniques: the temperature method, cervical method, and calendar method. Sa temperature method, ang ginagawa dito, kinukuha mo ang body temperature mo every morning. Tuwing tumataas ang body temperature mo, mas malapit ka nang mag-ovulate. Sa cervical method naman, ang cervix mo ay nagiging soft. Sign of ovulation is meatus merge o abdominal pain. Sa calendar method naman, dito mo tinatandaan kung kailan ang last na menstruation mo. Usually, 14 to 15 days nagmamature na ang ovulation mo. Things how to get pregnant using symptothermal method. Step number 1, take your temperature every morning. Gumagamit siya ng basal temperature, pagkatapos isusulat niya ito sa calendar depending on the stage of menstrual cycle. Step number 2, Notice ovulation symptoms. Pag hinawakan mo ang mucus mo, malapot siya na transparent na parang egg white ang itsura. Abdominal pain, breast sensitivity, and mood swings ay symptoms ng PMS o premenstrual syndrome. Step number 3, avoid bisphenol A. Si BPA, sinisira niya si endocrine system at ginadecrease ang sperm quality at libido ng mga lalaki. Sa babae naman, ginareduce niya ang egg quality at hormone production. Kung gusto mo mabuntis, iwasan mo ang ma-expose sa mga bagay na may BPA. Don't get too thin or too big. Kapag masyado kang payat, gina-prevent mo ang conception. Kailangan may 20% body fats ang kailangan ng katawan niya para mabuntis. Ang BMI dapat nasa 20 to 24 range. Kapag ang babae ay obese, ay nahihirapan siyang mabuntis kasi ang body fats niya nag-produce ng hormone na nakakaapekto sa menstrual cycle at ovulation. Yung mga malalaki ang katawan, mas least mag-produce ng sperm. The last number have sex at the most fertile time. Ang lifespan ng sperm ng lalaki sa loob ng vagina ng babae ay 2 days. The best day na makipag-sex ay hindi pa dumating ang ovulation. For example, nag-sex sila ngayon tapos bukas pa yung ovulation, there's tendency na mabuntis ang babae. Kapag nag-ovulate ang babae, ang lifespan ng sperm cell ay 12 to 24 hours. Dapat mas mauna ang sex bago ang ovulation ng babae.
Standard day method cycle beads.
This method is designed for women who have menstrual cycles between 26 and 32 days by Bickel and Fantahon 2013. A woman purchases a circle of beads that helps her predict fertile days. The circle of beads is to predict your fertile days. The first bead on the ring is red and marks the first day of your menstrual flow. Each day, move the rubber ring to the next bead. Brown beads are the safe days that can have sex unprotected. White beads days are not safe. It needs to avoid sex. But if you cannot avoid, you can use condoms. Brown beads, they are safe again. That her cycle is too short to use this method. If she has a monthly bleeding before she reaching the dark brown bead, appear on 27th day. If she reached the end of the string of beads, that is 32 days before menses, she know her cycle is too long for method, so it will start again. The advantage of standard day method is an effective modern FABM that is easy to teach and learn. It has no side effect. The disadvantages of standard day method: most family planning methods, standard day method does not provide protection against STD. Some women used easy system that using circle bead. There is an iPhone app available in place of actual beads called iCycle beds. It's easy to understand. Most women, however, is need to use a calendar to check off daily that they have moved a bed or they can lose track of system. Ovulation detection, it is another method to predict ovulation. It detects the mid-cycle surge of luteinizing hormone that can be detected in urine 12 to 24 hours before ovulation. How to do ovulation test? First, collect the urine, emerge from 15 to 30 seconds until entire as light pink. Wait the result for 5 minutes. The rest line can darken light and time so. While waiting 5 minutes, it drains and draw a dark line. If ovulation in 2 clearly visible lines, it indicates ovulation. The intensity of test line must equal intensity of control line. Ovulation may expected. This is optimum time of sexual intercourse. If no ovulation, if the test line weak over the control line, the wall concentration is still low to regular ovulation. So continue to testing with the new test. If no line detect appears, the result is invalid, and repeat the test as soon as possible.
Natural family planning, or NFP, is a term which includes all methods of fertility control that centers on a couple's awareness of the woman's fertile period. Side effect and contraindication for natural family planning. Natural family planning methods do not have side effects. If there is a contraindication to their use, it would be for couple who must prevent conception. Perhaps because the woman is taking a drug that would be harmful to a fetus, or the couple absolutely does not want the responsibility of children, because the failure rate of all forms is 25%. Women for whom pregnancy is strictly contraindicated should not use natural family planning. Such women include those with poorly controlled high blood pressure or cardiac disease. Ang pagkakaroon ng hypertension at mga heart-related diseases ay maaaring magdulot ng complication habang buntis ang isang babae. Halimbawa na lamang nito ay ang panganib ng pagkakaroon ng pre-eclampsia at matuloy sa eclampsia na kung saan ang blood pressure ay lalong tumataas na maaaring magdulot ng stroke at kumbulsyon. Ito ay mapanganib sapagkat maaaring ikamatay ng babae at ng ipinagbubuntis ito kung hindi ito mabibigyan ng agarang lunas. Second contraindication, those with high risk of fetal abnormalities, such as alcoholic or drug-abusing women, or if they are on teratogenic medications. Ito ay dahil ang alcohol, recreational at teratogenic na mga gamot ay maaaring magdulot ng mga problema sa pagbubuntis tulad ng mga depekto sa kapanganakan, panganganak ng patay, mga sintomas ng withdrawal sa sanggol pagkatapos ng kapanganakan, mahinang rate ng paglaki ng fetus, at mga problema sa pag-iisip o pag-uugali ng bata. And third contraindication, those with medical conditions that alter fertility indicators such as pelvic inflammatory disease or bacterial vaginosis. This could cause increased vaginal discharge until the condition is resolved. If the woman is using cervical mucus method, her secretions might be inaccurate to use. Next is thyroid or liver disease, which can cause absence of the normal signs of ovulation. And third factor, medication such as lithium, which alters cervical mucus production. Natural family planning and effect on pregnancy. Natural family planning methods have no effect if a woman should get pregnant while using them, as well as no effect on future pregnancies.
Natural family planning and effect on sexual enjoyment. Once a couple is certain of a woman's non-fertile days using one of the natural planning methods, more spontaneity in the sexual relations is possible than with methods that involve vaginal insertions product. However, the required days of abstinence may make a natural planning method unsatisfactory and unenjoyable for a couple. Coitus interruptus may be unenjoyable because of the need to withdraw before ejaculation. Fertility awareness-based methods of family planning use biological markers to identify fertile and infertile days of a woman's reproductive cycle. Sexual intercourse is avoided or contraception is used to fertile days to prevent pregnancy. Natural family planning is a type of fertility awareness-based methods that employs abstinence during the fertile window if being used to postpone pregnancy. Different modern methods of natural family planning are available for family planning, and several have a good level of medical evidence for their effectiveness in avoiding pregnancy. In general, a large majority of couples feels using natural family planning has helped them speak about their sexuality with their partner, improve their sex life, and improve the knowledge and understanding of their sexuality. Although natural family planning does require periodic abstinence or if postponing pregnancy, 3/4 of men and women
are satisfied or very satisfied with their frequency of sexual intercourse. The withdrawal before ejaculation. This is when the man removes his penis from the woman's vagina before he ejaculates comes, so the sperm do not enter the vagina. Sometimes this works, but it often does not even in the man comes just outside the vagina. Some sperm may still be able to swim inside, and there can also be a few sperm in any pre-ejaculation fluids from the penis. Natural family planning in the adolescent. Natural methods of family planning, with the exception of abstinence, are usually not the contraceptive method of choice for adolescents, as they require a great deal of thought and persistence, and adolescent boys may lack the control or experience to use coitus interruptus effectively. Girls tend to have occasional and anovulatory menstrual cycles for several years after menarche, and so may not experience definite cervical changes or an elevated body temperature each month. In addition, this method requires adolescents to say no to sexual intercourse or fertile days, a task that may be difficult to complete under peer pressure.
Natural family planning and perimenopausal. Ang mga nanay ay nag-start na mag-transitioning pag menopause. So, ang kanilang ovaries po ay nagsisimula ng bumaba ang kanilang hormones. Ang pagkakaiba po ng perimenopause sa menopause ay ang dito na po nag-i-end ang periods ng mga nanay. Ang perimenopause naman ay nagta-transitional time na mag-i-end na ang kanyang menopause. So, kapag hindi nag-menstrual cycle for 12 months, maaring officially reach menopause na si nanay. Ang hormone kasi ng mga babae sa kanilang katawan ay tumataas at bumababa during perimenopause. Kaya ang menstrual cycle nila is lumalaki or lumiliit. Kaya kapag may menstrual cycle pa si mother kung saan ang kanyang ovaries ay hindi na nagre-release ng egg, kaya di na kailangan gumamit ng birth control pills. Pag nasa stage na si mother ng menopausal, normally, meron na siyang minimal vaginal discharge na magiging resulta na mababang levels ng estrogen. Kapag fertile ang mucus ay watery and slippery, pero kung hindi fertile, ang mucus ay magiging thick or pastry. Natural family planning and postpartal women. Sa postpartal, ang in-station ay ginagamit sa family planning services within the first 12 months following childbirth. Ang postpartal contraceptives ay bumababa ng maternal at infant mortality na magpre-prevent ng hindi pagplano at hindi kagustuhang mabuntis. At sa birth spacing for family planning, magandang methods to for the family na ma-maintain nila ang kanilang pagbubuntis ng sunod-sunod na taon. Sa birth space po ay meron 2 to 3 years apart ang panganganak. Pero nowadays, iilan lang gumagawa nito dahil sa ibang nanay na ayaw mag-family planning. May ibang dahilan para mag-birth space nang hindi gumagamit ng contraceptives through exclusive breastfeeding and maghintay ng at least 6 months after tumigil na mag-breastfeeding si nanay bago mabuntis ulit. Para sa family planning, kailangan din improve ang quality ng bawat couple, lalo na sa sexually active. Kailangan pa rin nila ng contraceptive, counseling, like advice and information tungkol sa birth control. And thank you.
Presented to you by Almarie Reyes, Ana Dalid, Jeremy Alejandrino, Jean Ariel Gamboa, by Nashriela Banchawin, and Noursada Abdul. End of presentation. Thank you for listening.